Sister Janet. How are you? Good, good. Same here. I'm blessed. You know, the Lord's always good. I can't complain. He sure is. Yeah, the reason I was calling you was just to let you know you missed such a powerful service. The worship was on point. The sermon was on point. You know, Pastor, he know how to preach such a convicting message. You got to ask yourself, are you even saved? Yeah, and I had noticed that you weren't there, which is why I was calling you just to see if you were okay. Oh no, I'm so sorry to hear that. You know, I think I may be coming down with something myself because I woke up with like ear pain, and even throughout the day I've been feeling pain, and it's just like been progressing. Yeah, so I think I'm gonna have to get that checked out. Okay. Well, I hope you feel better. I'll definitely keep you in prayer, and I hope I see you next week. Same to you. God bless. Bye.
Hi, how are you?
Good. How are you?
I'm good. Please sign in.
Okay.
Who do you have an appointment with today?
Dr. Jane,
What's your name?
Glenda Garcia.
Okay, can you please have a seat? She'll be with you shortly.
Okay. Thank you.
You're welcome.
Hi, Miss Garcia. How are you today?
I'm good. How are you?
I'm good. I'm Dr. Jane. I'm going to be here with you today. So what brings you in today?
So the reason why I'm here is because when I woke up today, I've been experiencing like really bad ear pain, and it's been like coming and going, but it's just getting like really, really painful.
Alrighty. So I'm going to do an assessment, and then I'm going to take a look what's going on, and then we can go from there.
Okay, sounds good. Thank you.
Okay, take a deep breath for me. Okay, so I'm just gonna look in your ear, see if everything looks okay.
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 Glenda is experiencing acute otitis media, otherwise known as middle ear infection. Otitis media is an infection of the air-filled sac between the eardrum, which contains a tiny vibrating bones of the ear. Otitis media most commonly affects children, but adults can get it as well.
Okay, Miss Garcia. So from what I'm seeing, it seems as though you have an ear infection.
Oh no, okay. Well, that's like the last thing I want to be dealing with, especially being a mom of 3. And then on top of that, I have a really big exam next week coming up. So I want to be able to just be able to focus on that.
But don't worry, I'm going to prescribe you an antibiotic and it'll get you feeling better than ever.
The medication of choice is penicillin, which treats a wide range of staphylococcus and streptococcus infections, such as pneumonia, gonorrhea, influenza, endocarditis, ulcerative gingivitis, sinusitis, urinary tract infections, and what Glenda Garcia has, otitis media.
So are you telling me that this is going to solve my ear infection problem?
Of course, you're going to be feeling better in no time.
Oh, that's so good to hear. That's the last thing I want to be dealing with right now. So how exactly does it work?
Well, this bacteriostatic and bactericidal drug belongs to the beta-lactam family. It's a group of antibiotics, and it kills bacteria, and it stops their cell wall from growing, therefore preventing new cell wall formation.
I see. Okay, it's so funny that you mentioned that because we actually just learned that in our pathophysiology class. So can I ask you, what are the side effects to this drug?
Absolutely. Common side effects of this drug include mild diarrhea, nausea, vomiting, sore mouth. You could get white patches on your tongue or black hairy tongue. Some rare side effects or adverse effects can include seizures, oliguria, severe abdominal pain, or stomach pain, or sometimes even the yellowing of the skin or eyes. But just a quick question, do you know if you have any hypersensitivity or allergies to penicillin?
You know, I'm actually not sure if I am, but what happens if I happen to be allergic to it?
Well, a hypersensitivity reaction to penicillin would generally be seen as an anaphylactic reaction. You'd break out in hives, it would be really itchy, you would get a swollen tongue, swollen lips, making it hard for you to breathe. This can be very serious, and if it does occur, we would want you to immediately go to an ER and then contact your primary care provider.
Oh, wow. Okay. Well, that's good to know. I'll definitely be sure to be on the lookout for those symptoms. So, what antibiotics will you be giving me, doctor?
Well, there are other options to treat otitis media if you were interested. You can use drugs like amoxicillin and augmentin, which is a mix of amoxicillin and clavulanic acid. I'll be prescribing it to you 250 milligrams of penicillin to be taken twice a day, every 6 to 8 hours for 10 to 14 days.
Oh, okay. I see. Yeah, that makes sense.
Okay, Glenda, but there are a few things I want you to know before you start taking this drug. As you know, this is an antibiotic, so I want you to finish the drug completely. Even if you start to feel like your symptoms are getting better, I want you to finish it, because if you do stop, symptoms could reoccur, and then you could start feeling the ear infection again, and we don't want that. I do want you to take it on an empty stomach 1 hour or 2 hours before your meals. If you do find that you're experiencing signs or symptoms of hypersensitivity, like I said, go immediately to an ER and then contact your primary care provider. Also, please make sure you store the medication in a safe place, since you do have small children, I remember you said. Also, another thing, I do want you to consider contacting your OB-GYN, or even we could discuss this, starting a second form of a contraceptive, because this can decrease the potency of contraceptives you may be taking at the moment. Unless, of course, you'd like another baby, and that's totally fine.
Okay, yeah, thanks for mentioning that last part. A baby is definitely not something that I plan on having anytime soon, especially since I still have like 2 years of nursing school left.
Okay, so do you have any other questions for me today?
No, I actually don't. You actually explained everything pretty well for me.
Okay, perfect. So I think we're good here today.
Okay,
Alrighty, I want you to have a nice day and stay healthy. Take care.
to you. Thank you.
Bye.
Bye.
After taking her penicillin medication for her ear infection, Glenda Garcia was able to go back to her normal activities, including her church group.